Our next presenter is from Kelley Lee from the Faculty of Health Sciences at Simon Fraser University. Kelley Lee is a world-class scholar focused on the intersections between political economy and population health arising from globalization. From the reform of the World Health Organization to advancing collective action on range of shared health risks spanning communicable and non-communicable diseases, her conceptual thinking and empirical research established the foundations of global health governance scholarship. Her writing has helped shape the agendas in governments and international organizations.
In a nutshell, I've spent my career studying the interconnectedness of the world we live in, what we broadly describe as globalization, and the implications for human health. Beyond studying this association, I am interested in the collective action needed to protect and promote health in a globalizing world. When and where we need collective action, what should this look like, and what institutions make this happen? You might think that cooperation to tackle shared threats like COVID-19 is a no-brainer. This pandemic has rapidly spread worldwide, and it makes intuitive sense to work together. And yet so much of what has happened has fallen short. This is not how it was supposed to be. The World Health Organization was formed in 1948 to act as the directing and coordinating body for international health work. The current pandemic is exactly the kind of event that WHO was designed for. I wonder what the first WHO Director General, Dr. Brock Chisholm from Oakville, Ontario, would have made of current events. So why have things gone so awry? To answer this question, we need to focus on the concept of governance. Simply put, governance concerns how a society organizes itself through adopted rules and decision-making processes to achieve agreed goals. Governance occurs at many different societal levels. Global governance, for example, manages the world economy, international air traffic, and shared resources such as fisheries and oceans. For my doctoral research, I studied another UN organization, the International Telecommunication Union, which is responsible for governing the radio frequency spectrum and geostationary orbit. Global telecommunications are thus not the result of a free-for-all, but enabled by a system of rules, standards, and decision-making. From telecommunications, I landed my first academic job at the London School of Hygiene and Tropical Medicine with Dr. Jill Walt to study international health cooperation. Up to that point, global health governance had attracted little attention. This is because health systems operate and are governed at the national level. By the 1990s, however, it was increasingly clear that health within countries was being increasingly impacted by factors beyond the capacity of individual governments to govern. If we imagine globalization as a bubbling cauldron connecting countries closer together, evidence was showing that negative externalities were emerging from these processes requiring collective action. It was in this context that a slew of studies of WHO reform were initiated. I was given the opportunity to participate in several of these early efforts. It was a fascinating and unique opportunity to understand and try to support efforts to strengthen collective action. Talk shifted from national to international to global health cooperation. Over the next 20 years, I worked as a WHO consultant, formed and co-led a WHO collaborating center, and chaired a scientific group. I developed close working relationships with staff and respect and admiration for their unique work. At the same time, as a scholar studying global health governance, I stepped back to assess the institutional, financial, and political challenges faced by WHO. I thus found myself occupying a unique scholarly space. I injected concepts like structural power, hegemony, and social construction into the public health policy discourse. I tried to interrogate forms of power that lurk below the surface and privilege certain ideas, institutions, and interests. Which brings me to my current research. The WHO International Health Regulations is the legal framework governing collective action on the international spread of diseases. Article 43 specifically deals with travel and trade restrictions. States parties should not use these unnecessarily, base their use on scientific principles, and respect for human rights. During COVID-19, what we've seen is an unprecedented number of countries adopting such measures. Around 25% adopted such measures during previous pandemics. All countries during this pandemic have done so. A much wider range of measures have been adopted. causing severe economic and social impacts, and their adoption and lifting has been highly uncoordinated. Our early findings show that decision-making to apply cross-border measures involves balancing multiple policy goals. And decisions are being made in real time to respond to a pandemic that is highly dynamic, unique, and relentless. In theory, we might hermetically seal each province and then our international borders. In practice, Canada is one of the most globalized countries in the world. Managing rather than shutting our borders with trade-offs across different policy goals is what we see as happening. Given this complex task, our research is seeking ways to support decision makers with better evidence, better ways of deciding those trade-offs, and better mechanisms for coordination of border management across different jurisdictions. Our current research on border measures ultimately seeks to inform thinking about the kinds of global health problems where collective action is needed. Arguably, the COVID pandemic is ticking all of these boxes, and certainly this will not be the last pandemic we will face. So we need to figure this out. In conclusion, my work over the last 30 years or so has centered on the enduring themes of protecting and promoting health in a globalizing world. We've reached a critical point in the 21st century. This pandemic is showing us that markets and individual freedoms alone will not save us. Societies matter, and in a global era, we need to address the long-standing neglect of institutions underpinning global health governance if we are all to keep safe and well. Thank you.